changing central line dressings. Obviously, before we go in the room, we're going to foam our hands, make sure we're all clean, put on our non-sterile gloves, and take our supplies with us. Before laying down our supplies, we are going to get a purple wipe off our table, making sure that we allow it to dry the correct amount of time. Chester, we're going to change your central line dressing today. Before I go on and I touch his dressing, we remove our gloves and foam our hands again. See, the cells should be in the same place. Removing our dressing, we need to start carefully peeling up the first piece of tape. If you go layer by layer, it will come off easier. If you're having difficulty getting it to remove, you could take alcohol and slowly work it under the dressing.
Secure it with tape.
Oh, and we need to secure it to make sure once we get this dressing off, it's not going to pull. So we can secure this with tape, or we can pull it up and use the bedside clamps. I don't know if you still have those or not.
The idea being that there's not something that can be pulling on that line.
Right. Okay, before I go any further in taking that off, I want to put on a mask because I don't want to be breathing on my line. And we're ready to complete taking it off. Get both sides up. And before pulling at the gel pad underneath, you're going to get your sterile saline. Place a few drips on the gel pad, and that will help it release. Grab the gel pad and the dressing itself. Chester still wants to stick a little bit, and if that's the case, you can add a little more saline. Okay, so now we're ready to go to our sterile part. Foam our hands again. Get our dressing out on the table. It should be the blue packaging, which says with CHG. If it says with BioPatch, that's not going to do you any good. If for some reason you have questions about the steps, inside here is step-by-step instructions. Get our dressing kit out, open it up. Obviously, if we're not breathing on it, we don't want Chester breathing on it either. We're going to give Chester a mask, and if he can't put it on for himself, we're going to help him out. We have hand sanitizer in here, So when you're ready, after your gloves are open, you can sanitize your hands again. I'm going to completely open my dressing. Don't lay this on the patient because this plastic slips right off if they move. And hopefully you're a little more organized than this and you have a trash can next to you. You can throw all your trash away. Open up your gloves. Obviously don them, keeping them sterile. If you have an issue or something touches something, just get a new pair of gloves and start over. And open our dressing kit. And the neat thing about this is that it gives us everything we need step by step. So if you need to clean up some of your saline beforehand, you can kind of dab him a little bit. Your Prevantix. We're going to open this up. When we scrub Chester, we want to start at the line, pressing down with our finger so we get some friction there. Scrub 1 minute, east and west. Once that minute's up, please use a clock to time yourself. Scrub another minute, north and south. And that minute's up, and now we allow it to dry for 1.5 minutes. Please use a clock to time every one of those steps, because if we don't, we're nurses and we get in a hurry and we think we do things for a minute and we don't. Skin prep is our next step. We want to make sure we apply this so it's around the outside of the dressing, making a square around. You want to allow that to dry. To begin to know if it's drying, stick your fingers together. Once your fingers don't stick anymore, you can go ahead and apply your dressing. Dressing one side or the other. The backing peels off very easily. We're going to drop the CHG correctly around the line. And then we're going to work out from there. Making sure we get it secured down good. Grab the end, and for some reason these stick really well. Work your finger around it, bring it around so it's completely sealed. Doing the same thing with the other side. Get a hold of your line, bring it up, and you want to grab the ends of this. Put one side down, go under, put the other side down, secure it down well. Write your date and time and your initials on here. Don't do it after it's on the patient. Most people don't take kindly to being written upon. Put that directly over that hole. Those are the exact places that these pieces of tape go. If it's not done like that, we're not following manufacturer recommendations. And that's a central line dressing change. And please document it. When you go into document, make sure that you only click dressing change, not assess and dressing change on your first drop-down box.
Thank you, Pam.
Thank you.
Hi, we're going to review peri-care with a patient that has a Foley catheter. And this is in preparation for our skills checkoff that we're going to do for ICU. So first thing we're going to do is foam our hands or wash them with soap and water. Identify our patient, make sure we got the right patient with the 2 identifiers. Gather our supplies up. So we need our CHG basin with some warm water in it. Some clean gloves. And our CHG foam, or we could use the CHG wipes, but we're going to use the foam to demonstrate today. Okay, so we need some washcloths and towels. If the patient is visibly soiled, we're going to wash with soap and water and dry them completely first. And then we're going to take 1 washcloth and apply CHG foam. And we're going to liberally clean the patient. Okay, and then we'll put that into the dirty clothes. And then we'll take a fresh washcloth, wring it out. We're going to wipe down one side with 1 washcloth. Get another washcloth, fresh. Wipe down the other side. And then we'll wipe down the middle. Getting inside the labia, wiping it thoroughly. And then we'll dry. And then with another washcloth, we're going to take the CHG foam and we're going to apply it to the catheter and wipe it down 6 inches and then just let it dry. Leave it to air dry. All right, that is our Foley catheter care, and then we'll document that we did do the Foley care with CHG. Now, another option would be to wash the patient with soap and water and dry it, and then using the CHG cloths, again, 1 cloth down one side, a fresh cloth down the other side, a 3rd cloth down the middle, and then a 4th cloth to put CHG at least 6 inches down the catheter. And just that you can let air dry if you use the cloths.
Okay. And those cloths are located in ICU only at this time. This is not for the regular floors, I believe. And then also those baths, those can be used for total care as well, for doing the bath as well. There are 2 cloths per pack, so you have 6 cloths in the entire packaging, which should be plenty to complete all care necessary. And you don't have to worry about mixing anything or making sure your dilution is incorrect or whatever. So it's preferred, but you are welcome to use either one, whichever one you prefer is fine. So Val, in order to do this, I would say you need a minimum of 6 washcloths to do pericare, correct? So
You're
we
gonna
have,
clean them first,
yeah,
and then you
well,
need
yeah, because
4.
we need 3 for the,
1, 2, 3.
and then drying,
And
patting
then-
dry, which would create a towel too. And then the one to apply to the Foley.
Yes.
So yeah, so you need a fair amount of linens for this. If you're not carrying enough linen in the room, you're not doing it correctly. So it's important to be aware of that.
All right, I'm going to demonstrate the quick release tie for our restraint checkoff that we're going to be doing for all of ICU. So we're going to take our soft restraint. We already have an order, of course. We're going to apply it with the Velcro, making sure we can get at least 2 fingers in there so it's not too tight. Then the string that is the furthest away from the D ring, we're going to take and feed through the D ring. And then we tie this twice. We're going to make a knot. And the reason we do that is we don't want it to get looser or tighter on the patient's wrist. Then we take both strings together and we're going to feed them through the bed frame. I'll use this. Okay, so we feed that through, and then I'm going to take it up and I'm going to make a slip knot one time for the first one. Now that actually is correct, but to make it a little more secure, I'm going to make my loop smaller, feed it through a second time, and then pull on it to tighten it up. And now, Katie cannot get out. And if I did it right, it's a quick release tie that I can get her out of quickly if there's an emergency.
Yay! Everyone's safe.
Yay.
Okay, thank you, Val.